going to show some features of our monitoring portal and run through some of the other discussion points. So we're going to continue here with our high acuity, high risk patient. When first logging into the web portal, we're going to be navigated to our main dashboard here, the patient or member list. If I scroll over patient names, I can see the most recent readings by measurement type. I can also see some other information like smart device number, group, site location. You can sort alphabetically by name here. You can sort by least recent to most recent. And then you can also sort by group and site. In the search bar here, I can search for patients by name or by device IMEI number. This H symbol here lets me know that a patient has been notated by a coordinator as being admitted to the hospital or in the hospital currently. So now I'm going to show you where our patients live in our dashboard. If I select a patient's name from the list, I'm going to be taken to what we call the member detail page or the patient detail page. We're going to land upon the Vitals tab here, which again shows an overview of their most recent readings by measurement type. These colored dots would indicate a breached reading. If I select the History tab here, I can view a timeline of this patient's readings as they came in, regardless of device type. If I select a particular measurement type, I can dive deeper into just those readings. So these readings are available in a list view like you see here, as well as a chart view. If I scroll over the data points, I can see some additional information here. These red dots indicate a breached reading, and then green would be in-range values. The last tab here allows us to set threshold parameters to monitor out-of-range values for the population, for this patient. We can set, let's see, I have this screen, there we go. We can set minimum and maximum values for moderate as well as high thresholds here. And then they can be modified and adjusted as needed. So when a threshold is set, it's going to adjust for all care team members or coordinators as we call them, but this can also be locked so just one coordinator can adjust these settings. If an out of range value is measured, it's going to appear here, up here in the notifications tab, with the option of sending a notification to clinician email as well. You would just need to opt in for email notifications. But here's what that email notification would look like. It'll include a hyperlink to the patient's page. So then you can access this patient's member detail page to view their readings. Right now we just have email and portal notifications, but we are very aware that text is really important, and so this feature's in testing and it should be coming soon. You can adjust your notification settings by going to the Notifications Preference tab here. There's an option to also be notified on new measurement readings. So for example, if you have a very high acuity or high risk patient, maybe they have a risk of infection when they leave the hospital, you can opt in to receive an email for every new temperature reading they take or every new pulse reading they take, for example. And then you can have it here, appear here in the notifications bar, as well as notify you via email and then text in the future. So we're going to navigate over to the Notifications menu tab. Here we can see a list of some readings. The prioritization list here is flagged readings are at the top. So these would be breached readings that have been flagged by a coordinator for follow-up. If I scroll over, I can see who left that. I would then be able to select the reading, navigate to the patient's page, and see what notes might be there. So the prioritization list here is flagged readings followed by high breached readings, moderate breached readings in this golden color, and then on new measurement readings here in blue. To acknowledge alerts, we can select the patient's name, and then this is going to give us a pop-up notifying that this is going to remove it from all coordinators' portals. So selecting the reading is going to take me to the patient's page where I can then view the reading. So let's go ahead and look at temperature here. So I could go to that breached reading, leave a note in here. It could be intervention steps, could be that this has been acknowledged. If you want it to be followed up by another team member or create a task for yourself, you can leave a note, flag it for follow-up, and it'll return to the Notifications tab here. But by selecting a notification from the list, you're going to remove it from this list. You can make notes, list any interventions or next steps needed or taken, and then this would indicate that the reading's been reviewed, noted, and acted upon. So next we're going to look at some options for care documentation tools and reporting. Some of these options can be integrated with the EHR to capture the patient information in clinician notes so you're not having to repeat yourself or there's less repetition. So on the profile here, there's some information we can update like group and site, phone number, first, last name. Under the Management Details tab, there's some additional information here. This condition box is free text, so you can include anything you'd like. It could be things like medication list or the treatment plan here, diagnosis codes. We also have the Notes tab where you can populate notes. It's automatically going to capture the clinician's name, date, and time that this note was entered. These can be exported via CSV or PDF. You can enter things like time and activities, intervention steps, important notes, and then all coordinators that have access to this patient would be able to see these notes. And then on individual readings, like we saw just right before this, you can leave notes as well. And that'll capture the clinician's name, date, and time. So onto our reporting features. If I select the export option here, we have both individual and group reports. So here you can select the time period for the report, what measurements you'd like included, the report format. For group reports, you would select include all available medical records. If you want all patients' readings in one spreadsheet, you could do export as a single CSV file. You would then select get report, or you can send it directly via secure email from the portal. So here's an example reading report. So here I can see the time range, what measurement types were included, the patient's information, the care provider's information that exported this report, and then here I can see it's blood glucose, and I have a PDF of their readings by date here. So next we're going to look at some options for patient and care team communication. So if I go back to the patient's member detail page and then their vitals tab, I can see this member note feature here. So clinicians can securely send and receive messages from patients through the portal. Clinicians can type a message. Patients can then see that message either through the patient portal application on their smart device, like their tablet. They can access the patient portal via a web browser, maybe from their computer. And then patients using the Life365 Health mobile app also have access to the bidirectional messaging feature. Patients can respond through the mobile app or their smart devices and on the web. So here I can see that me as the clinician, I sent a note, please take your temperature reading every hour. And then if the patient had responded, I would see that in the list here. We also have two-way video as a means for communication with the patient. We are video vendor agnostic. If you have a platform you're already using, we can incorporate that. Otherwise, we have a vendor we work with. If using your vendor, we can include their two-way video application on the smart devices for the patients, for example. Our video vendor or your video vendor, we could integrate and include access through the portal through, here you can see it says video chat. So next on the list was patient-facing features. So I'm going to share some of our smart device patient engagement applications that we've developed, as well as some third-party apps. This is a resource that we include for patients. We typically have this printed off and included in their kits for them. We don't assume they've ever used a smart device before, so we show them how to power it on, plug it in, starting from the bottom. So the applications we have a camera, so this can be used to capture wound images, for example, or other images that can then be shared during a video chat conference. We have our two-way video application. So this includes some screens and an overview of our preferred vendor, but this would be updated to include yours if you're using like Zoom or something. We have a resources application. This is where educational content can be loaded and preloaded for the patient. This could be content you create. It could be licensed content. This could be PDFs, videos, URL links to websites. And then these can also be customized like by group or disease state in the portal, which we'll show. Patients also have access on the smart devices to survey questions. These can be surveys that are custom developed by the customer, or they can be licensed or clinically validated surveys. Patients can have one or more on the smart device to take, and then clinicians will be able to see their responses from within the portal. We have a quote-unquote patient portal. It's really just an application for the patient to log in and view their readings. Again, they can access this directly on the smart device or from any web browser. So I'll just show you what the web browser one looks like. It looks pretty similar to the coordinator's view. It's just a little bit watered down. So here we can see member note. They have access to the secure bidirectional messaging. And then they also have access to their readings here. So again, they can select a measurement type and view the list and chart views like the coordinator can. We also have patient reminders. Clinicians can schedule reminders to alarm on the smart devices for the patient. These can be medication reminders, appointment reminders, one-time reminders, similar to how you might schedule an alarm or a reminder on your phone for yourself. The patients will hear a chiming noise. They'll also see a pop-up on the screen. They'll then be able to open the smart device, the tablet, unlock the screen, see what that reminder is telling them to do or to complete. The patients will have the option to select completed or snooze, and then depending on how the patient responds, the clinician would then see that in the portal of how they responded. Applications can be customized on the smart devices, and we can include third-party apps. And then tablets can also be white labeled, so it doesn't have to be our branding, it can be your branding in there. For our intermittent monitoring chronic disease patient, I'm going to show how a patient monitoring their blood sugar levels could use our system for that. So I'm going to be showing our mobile app and our passive hub solution. Our complete tablet solution kit with telehealth could be a great option for those high acuity patients that might need the two-way video communication and a lot of the other features, whereas these solutions might be a better fit for those managing chronic conditions or those that have their own smart devices and they can download an app. Patients can take glucose readings using our turnkey solution, the passive hub. It's hands-off. It's really just meant to capture the data, send it to the cloud for review. So I'm going to share a quick video of taking a glucose reading using that passive hub solution. Let me pull that up here. So here we can see the strip's been inserted, the countdown was initiated. As soon as the strip is removed, Bluetooth connectivity is started.
Glucose level 111 milligrams per deciliter.
The passive hub captures that data reading, announces it out loud, and then it's transmitted to the cloud for clinician review. I'm going to hop over to the mobile app here. Let's say a patient is using a non-connected, non-Bluetooth glucose meter, or they've lost connection with their Bluetooth meter for whatever reason. They can always manually enter a reading, and it is going to be denoted as manually entered within the portal. So if you see a funky number, maybe you know they did a typo. So here I can select the glucose level. I can select the meal tag, before meal, after meal, fasting. I can also put in a note here, maybe what was eaten for my personal reference in the future. I can save this reading. And then as a patient, I can also get some immediate feedback if I select the reading, and then I can go ahead and take a look here. So I can see that this reading was within a good range. Here I can see it was a little bit higher. And then I also have access to some chart views. So I can see I've been up and down quite a bit these past few days. And then I also have a pie chart that kind of lets me know between this week I was within range 72% of the time. 22% of the time I had high glucose readings, 6% of the time I had low glucose readings. So it's great to have some immediate feedback as a patient. We're going to jump back to the portal here. So here in the portal we can see the manual reading we just entered has appeared for our diabetic patient. I can see the meal tag. And then you also wanted to see about scheduling reminders for a patient, reminding them to take their readings. So I'm going to navigate here to the Life365 apps dashboard. We briefly talked about how reminders can be scheduled for patients. So reminders can be scheduled for users that have the smart devices, alarming them, alerting them to complete some type of task. And so what that looks like is you would simply select the add button and you would create the reminder. So this could be a recurring reminder, a one-time reminder. It's all free text, so the clinicians can type in whatever they would like. This reminder can always be edited or removed. So if it was at 10 a.m. but you want to change it to 7 a.m., you can adjust that here in the settings. And then depending on how that patient responds to the reminder on their smart device, you can see a history of their responses in the Reminders app dashboard. So I can see that one was missed, this other one was completed here, and then these can also all be exported in a report. So you'll have a list of all of the historical reminders and then the responses that the patient completed. So that is right here under exit reports. So you can export the reminders as well as survey responses here. You also asked to see the process for pairing a Bluetooth device, or if a device loses connectivity, how would they reconnect? So I'm going to show a video of pairing a glucose meter. Quick video here. So this video showed how a device is paired before shipment to the patient, or how a patient would pair the device to the mobile app if they were doing this themselves. For many of the devices, pairing is as simple as taking a reading. This particular glucose meter model required a code to be entered. However, this is about as difficult as it gets, but it's still pretty simple and takes under 30 seconds. This glucose meter actually no longer even requires a code to be entered, making it even more simple. And as Kent and others have mentioned, we do connect to many different types of glucose meters and devices. Go back to the portal here. Under the patient surveillance item, you had requested to see options for the collection of patient self-reported data that was not biometric in nature. We do have customizable patient surveys available. These can be designed by you, or they can be clinically validated or licensed surveys. So here in the portal, I'm going to navigate back to the patient's page, their member detail page. I'm going to select the app's dashboard here, and then I'm going to select surveys. I'm going to select which survey type I'd like to view responses for this patient, and then the date of the survey that they completed. So I'll just switch views here to see their response. If I go back here, remember under the exit reports, if you want to see all of the patient surveys that they took and a list of their responses, that's here under exit reports, so you can have those and export them. And I will just point out that here in the upper right hand corner, this patient doesn't have a tablet or a smart device assigned to them, but if they did, you'd be able to see the battery level of the device and whether it was plugged in or not, which is a nice feature. This piece requested in the discussion point was multiple programs. How to view patients in multiple programs from a single view, and risk stratification features. So here I'm going to show the configure screen, so we're still on that member app dashboard. And here below I can see that there's a few programs listed here, but multiple programs can be created. So these programs or packages could include the apps that a patient would have on their smart device, educational content specific to their program, what surveys they have available, what language their tablet and information is in. This can be very customized to meet your population and use case needs. So for example, one group might not have the same applications on their smart device as another group. Another group might have different educational content than another group. So these can be customized to meet your use cases. We're going to go back to the patient dashboard. The main dashboard member list, patient list here. There's some options for viewing groups. So like I mentioned earlier, you can sort by group or site. We can also tailor the sorting and filtering and create some grouping functionality to meet your needs. But right here, if I select group, it's going to organize it alphabetically. So here I can see I have all of my diabetes management patients, and then below that, CHF patients. If I switch it, I'll have the CHF patients at the top and diabetes management patients down here. You can also sort by site. So here I have all of my Scottsdale population patients, all of my Phoenix population patients. And then as far as risk stratifications go, we went through the notifications tab earlier, but this might be maybe where your team starts their day, just looking at the patients that might need some attention, those with flagged readings, breached readings, moderate breaches, new readings that might need review and follow-up. So now we're going to discuss some of the advanced capabilities and future vision with